Assalamu alaikum dear viewers. In this video I am discussing about orbital cellulitis. So what is orbital cellulitis? It is an infection involving the contents of the orbit, adipose and muscle. So infection on the adipose and muscles, that is the content of the orbit, is called orbital cellulitis. If we notice the image, we are seeing how orbital cellulitis patient is present. There is eyelid swelling, post-septal infection it is. Now about the etiology of orbital cellulitis. It is most common, children are affected than adults. Bacterial rhinosinusitis is the most common cause. Then orbital trauma with fracture of foreign body, dacrocystitis, teeth, middle ear, face infection and infected mucocele. So these are the consequence causes orbital cellulitis can be developed. I am again repeating the etiology portion of orbital cellulitis, that children are much more affected than adults. Bacterial rhinosinusitis is the most common cause of orbital cellulitis. Remember, bacterial rhinosinusitis. Other causes are orbital trauma with fracture or foreign body, dacrocystitis, teeth, middle ear, face infection and infected mucocele. Now about management. We manage orbital cellulitis by broad spectrum antibiotics, example vancomycin plus piperacillin plus tazobactam, and surgery. So we manage orbital cellulitis by broad spectrum antibiotics, example vancomycin plus piperacillin, tazobactam, and surgery. Now about the comparison between preceptal cellulitis and orbital cellulitis. So what is the difference? In preceptal cellulitis there is eyelid swelling is present, and orbital cellulitis also eyelid swelling is present. So both preceptal and orbital cellulitis present feature is orbital or eyelid swelling. Now about eye pain and tenderness. In preceptal cellulitis it is may be present, but orbital cellulitis, yes, deep eye pain. Now pain with eye movements. Preceptal cellulitis no, but orbital cellulitis there is pain in eye movement is present. Patient feel pain when movement of eye occur in orbital cellulitis. Now about proptosis. Preceptal cellulitis no, but in orbital cellulitis usually may be subtle. Now about ophthalmoplegia plus minus diplopia, that is absent in preceptal cellulitis, but ophthalmoplegia plus minus diplopia is present in orbital cellulitis. About vision impairment, in preceptal cellulitis that is absent. In orbital cellulitis vision impairment may be present, afferent pupillary defect. Chemosis. In preceptal cellulitis chemosis is rarely present, but orbital cellulitis chemosis is may be present. Leukocytosis. In preceptal cellulitis that is may be present, and orbital cellulitis also leukocytosis may be present. So we can understand that preceptal cellulitis and orbital cellulitis main difference is that in preceptal cellulitis pain with eye movements or eye pain, these features are less, where in orbital cellulitis there is deep eye pain and pain with eye movements is present. So this is all about orbital cellulitis. Please do subscribe and share Dr. Emma's Medicine YouTube channel. Thank you.